going to talk to us.
Ron, for giving me this opportunity to put the cornerstones about what we should know about hydration in older adults. You will read almost everywhere that the elderly population is subject to dehydration, and that in many places like hospitals, the place where they stay, there are many dehydrated people, and we have all been educated with that. I would like to trace the path why we think this is so. First question: do we believe that water intake goes down with age? Would you say yes? Raise your hand. Would you say no? Raise your hand. So many people think here that water intake goes down with age. This is an epidemiological study taken from the NANS, the big American epidemiological studies, the one that took place 2005-2006. And as you can see, this is plain water drunk by the people across the age group. And you see that indeed the plain water that is drunk decreases, but only so for people above 60. If you take moisture in the beverage, it's the same thing. If you take moisture in food, there is no difference in the amount of water coming from food. And by the end of the day, total water in this large amount of people, almost 4,000 people, significantly across the age group. So all the ones that have said yes so far are right. Second study, another NANS study, a previous one, 1999-2002. And you see that the people here are fewer, but essentially they are older. And you see that the water intake keeps going down. I have difficulties with two things at the same time, sorry. So indeed, the water intake goes down, and in the people that are older than 80, 85, it is 500 mL less than what it was just around 70. And the moisture from food is slightly high, Ron? You would say 20%, but it's not that bad, 23, 26%. I suppose it suggests that the quality of the data is good enough. So the one that answered yes are still right. Are they going to be wrong sometime? Well, maybe. This is another study, and this time instead of asking people what they consume, we measure water turnover. We put a label inside the body, which is an isotope, and we measure the disappearance of this isotope. And the rate of disappearance tells us how much water goes through the body each day. And when you use deuterium, it's about 7 to 10 days average rate of turnover. And if you look at this study, which is a decent one, 300 subjects with an isotopic measurement, well, there is not that much of a change in water turnover across the age groups. Not even so, not so in women or in men. So probably depending upon the methodology we use, we may get different answer, but I would say that it is probably right that water intake goes down with age, making the person more vulnerable to a demand in water, for example, in face of exercise or heat or whatever, fever or whatever. Still, the same study story about isotopic measurement. We saw the mean, but you see that a large number of people are distributed around a large variability in water turnover from 1 to 1.4 liters, very few subjects, but still some with a high turnover, more than these 4 liters that have been suggested by Professor Geller. Second issue is, what about thirst? Would you say, please don't read, would you say that thirst decreases or increases with age? Who says it increases? Thirst, the sense of thirst. Who says it decreases? Well, it's pretty level. Sorry?
I understood you wrongly.
You didn't understand the question. I didn't either. Asking you the question, I felt, oh dear, how am I getting out of this? Anyway, thirst is, I've heard from Professor Geller, that is something that we learn. I'm not that sure that it's only this. And I'm going to show you this with elderly people. So thirst is the manifestation including dry, scratchy mouth, throat, chapped and dry lips, lightheadedness, dizziness, tiredness, and all these feelings and signs that go with dehydration. So here we're introducing a sort of a challenge, which is a physiological challenge. Dehydration, i.e. the loss of water, generates sensation in a body, in a human being, leading this human body to drink. This is exactly the same we have for hunger. It's the same type of definition. This is a model that, a simplified model that has been published in 2001, which summarizes how thirst works. First, you have situation when tonicity increases. For example, you exercise in the heat, or you just reduce your fluid intake. The osmoreceptors will sense the increase in tonicity, then thirst will come and you will take some fluid, lead to osmotic dilution, and this is a feedback loop that works perfectly well. This is simple. Osmoreceptors are used, and they are probably somewhere in the brain sensing tonicity. Then when you decrease volume, when you are dehydrated by any mean, you have the baroreceptors that are in the arterial walls that will promote thirst as well, leading to water intake. And again, you have a feedback loop. And this osmotic dilution can also lead to a decrease in salt and appetite that had been triggered by the decrease in volume. So all this is pretty classical. You have three actors: osmoreceptors, baroreceptors, and the renin-angiotensin-aldosterone system, meaning that when the volume decreases or when the osmolarity increases, thirst is coming on. Then there is a recent regulator that is the water that is going through the throat. And this is very interesting. The experience is you put a gastric tube in subjects and you study them in three conditions. The precondition being that they are dehydrated. Either you give them ad libitum intake by the mouth and you ask them to quote thirst, or you give the fluid through the tube, or you give the fluid through the mouth, but you take it off from the stomach as it comes into the stomach. And in the first and third condition, i.e. when the water is going through the throat, then thirst decreases. And I'm getting very thirsty, I can tell you. But when water is going straight away inside the stomach, the decrease in thirst is not operating at the same rate, meaning that there must be some sensors around the throat that are sensing the water that is passing through, and which is a third mechanism that has been described recently. Why are older people drinking less if they do so? Well, the general knowledge, and it's coming from Barbara Roll's studies dating, in the 80s, and most of the work support the statement that they drink less because the thirst sensation is impaired in the elderly. Is this true? Well, all the studies that have been performed, and you'll see a table that summarizes that, is the same methodology, dehydration, evaluation of first through visual analog scales, and the evaluation of ad libitum water intake after. And if you look at all these publications, either by increasing osmolarity or decreasing volume, according to the model I showed you, you see most of the studies show that as compared to young subjects, the older subjects have a decreased or impaired thirst. So if they have an impaired thirst, they fight less against a dehydration challenge. This I will go through. And thirst is still regulated by the same phenomena like plasma volume and plasma osmolarity in the elderly, but there is something wrong with the volume changes. And this is a slightly complex experiment in which young and older subjects were subject to dehydration. Therefore, the thirst rating increased, and you see that the thirst rating increased less, 80 out of 120, as compared to almost 100 out of 20. So this is what we just said a minute ago. Now, if you take these dehydrated people and you put them in a pool in water, but the head out of water, the volumes, the fluids in first, but also there is a difficulty to regulate first with this, which is a volume signal. Another study which is very interesting tends to query where is thirst regulated inside the brain. And this is, you see, a recent study in a very good journal, always the same challenge. Here, you have 10 young subjects, 10 older subjects, all healthy. You provoke an hypertonic saline infusion, raising osmolarity. It is the same in both groups, but you see that the water intake after the challenge is much higher in the young subject than in the old subject. It is basically what we said before. What you see here is that osmolarity in the two groups, the triangle are the young ones and the squares are the old subject. You have this hypertonic infusion, and you see that logically osmolarity increases along the challenge, and when you allow them to drink water, osmolarity decreases. But what you see here is that osmolarity decreases more so in the young than in the old subject, just before, because they drank more water here than the older subject did. So this is fairly logical. Now, if you look at vasopressin secretion, you see that in the young subject, vasopressin increases with the hypertonic infusion. It is expected, and when they drink, vasopressin decreases. What you see in the older subject is vasopressin is slightly higher at the beginning, and this is a matter of debate. There are many publications arguing pro or con this increase in basal vasopressin. But you see that vasopressin hardly changes across a challenge and hardly changes when these subjects drink water. And if you look at the thirst rating on a scale 0 to 10, across the challenge thirst increases, but when they drink water, when they have access to water, free access to water, the thirst decreases largely in the young subject, but decreases less so in the old subject. Again, there is an impairment in the regulation of thirst. This is what we have said so far. But the very nice thing about this paper is that they are doing through PET scans, they are looking at regional blood flow in the brain, and during the course of the hypertonic infusion, there are many places within the brain that highlight, probably related to the various physiological consequences of this hypertonic stimuli. In this cingulate cortex, it is the place where when osmolarity increases, you have the signal that increases. And you see that it is not the same place within the brain where the signal increases in young and in old subject, and there is only a small place that overlaps. So first thing that is interesting is that it may be that thirst is not regulated in the same places or doesn't influence the regional blood flow of the same location within the brain. But the more important thing I consider is this relationship, which is the decrease in the signal when the subject drink water in young and in old subject. And although, and depending upon the volume of water they have been drinking. And what you see is that the young subject decrease their signal with a shallow slope, but the older subject decrease the signal with a much steeper slope, as if the brain was reacting faster to water, sensing thirst less, but replying faster, as if the decrease in thirst appeared faster in the older than in the younger subject. This is only an imaging study, so it doesn't provide any explanation, but certainly this is a tool that is easy to use and that we will certainly be seeing more and more in future studies. This is the water turnover we've talked about already, and I want to finish with a sense of hydration in the elderly. All this I've said is physiological regulation. Now, what's going on in the body? This is a study we've performed in France. I'm sorry, it's still in French. It's total body water in almost 2,000 subjects aged 18 to more than 70 years. And as you see, total body water in men and in women is decreasing with age. This is something we knew. There are many studies that are showing that are cross-sectional and are also longitudinal, but this one is acquired with a simple tool which was bioelectrical impedance analysis at the time. Now, with isotopes, what is the distribution of water between the spaces? And it's a rather complex chart, so I'm going to go through with you slowly. On the x-axis is total body water. On the y-axis there is extracellular water. And if you consider the cloud of points, there is a proportional relationship. As total body water increases, extracellular water increases, which is fairly logical because extracellular water is a sort of a proportion to total body water. But if you split the cloud in three groups, adults, healthy elderly adults, and aged patients. The aged patients are, I think, around 100 people that I took from the medical ward where I was working. All the other ones were community dwelling people like you and me. So if you look at extracellular water here in the adults, the squares, they are in this range. So at the higher values of total body water and extracellular water, the healthy elderly people are the open square. They are more here at lower levels of total body water. This is what we've seen in the previous table, and therefore at a lower level of extracellular water. And if you look at the slopes of the two lines, they are pretty similar. It is as if in the healthy elderly subject there was as much extracellular per liter of total body water as in the healthy adults. But what we see here is something different in the aged patient. They are only different because they are diseased. And for any value of total body water, the extracellular water appears much higher than it is for the healthy subject, suggesting that there is an inflation in the extracellular space per liter of total body water in the diseased patient as compared to the healthy one. And this one is what I think is the best indicator of hydration, which is intracellular water as compared to total body water, or the proportion of intracellular into total body water. And you have exactly the reverse. The healthy adults are here, high total body water, high intracellular water. The same open circles are here, healthy elderly people. The slopes are pretty well the same, but the diseased person have a lower value of intracellular water per liter or at any value of total body water, suggesting that there is a decrease in intracellular water per liter of total body water, i.e. a cellular dehydration, i.e. the amount of water inside cells appears to be lower per liter of total body water. And if instead of putting total body water here, you put fat-free mass, you have exactly the same argument with healthy elderly here, adults here, diseased patient here. Per kilogram fat-free mass, you have a lower amount of intracellular water, suggesting again that there is less water per kilogram of cell. And there, I've finished. So to summarize, decrease in total body water, this is true. I've not covered that, but we know there is a decrease in glomerular filtration rate, decrease in urinary concentration ability, increase in antidiuretic hormone, increase in atrial natriuretic peptide, decrease in aldosterone. All of these are regulation. Decrease in first mechanism, decrease in free water balance. All these factors are making the elderly person vulnerable to dehydration. In front of a challenge when there is a shortage of water, the elderly person will defend his or herself much in a worse way than an adult will do, leading to higher prevalence of dehydration in these circumstances. Thank you.